I'm Joni Winters, Winters Law Firm, and we're here today to talk about Families First Coronavirus Response Act. This is an act that was passed on March 18th, signed into law by President Donald Trump. It's sweeping legislation that affects employers of every size. Congress in a previous bill set aside $8.3 billion to fund these initiatives, and it's important that all employers across the United States be aware of how this impacts them and their employees, and that's the focus of our discussion today. I just want to remind everyone that this is for training purposes only and does not constitute legal advice, and also that the information we're providing here today is very fluid, subject to change almost immediately after we post this, so please check back for updates periodically. Today's date is March 25th, 2020, and it is 2:30 in the afternoon, so anything that occurs after that we'll be posting periodically. Families First Coronavirus Response Act is sweeping legislation that will affect employers of every size. We have seen two pieces of legislation so far. There is more to come. In fact, there's legislation that is likely to be signed today, all to assist in this unprecedented worldwide event. Families First Coronavirus Response Act is the focus of our discussion today, and it is the act that assesses the needs of the individual and the employer, and in particular the needs that come with employees who are ill with the virus, who have to care for a family member who is ill with the virus, or for employees who have lost their child care options due to the pandemic. Although there are many other components to the act, we're going to discuss the three that have the biggest impact on the workplace, and they are the expansion of Family and Medical Leave Act, the Emergency Unemployment Insurance, and the Emergency Paid Sick Leave. We'll discuss each one individually. So let's begin with the expansion of the Family and Medical Leave Act. The original FMLA, which is still in place by the way, is for unpaid leave for the care, birth, or placement of a child, including adopted or foster children. It is for 12 weeks, and it is required of employers with 50 employees or more. For employees to access this leave, they must have worked a minimum of 1,250 hours in the preceding year. With this expansion, we now see that FMLA may be used for a qualifying need related to a public health emergency, but this is actually limited to allowing leave for eligible employees who cannot work or telework because their minor child's school or child care service is closed due to a COVID-19 emergency. This is the only reason for this leave, unless, of course, the employee or a family member of the employee has COVID-19 and it rises to the level of serious health condition as defined under the FMLA. Employees are eligible for this leave only if they have been employed at least 30 days. Under the circumstances of a public health emergency, FMLA applies to employers with 500 or less employees, changing the requirement of 50 or more. The Department of Labor may, upon the request of an employer, and with proof that an employer will be substantially harmed, the DOL may exempt a small business with fewer than 50 from this requirement. The first 10 days of this leave are unpaid, but the employee may substitute accumulated unused leave if they so choose. Subsequent pay, and we'll discuss this in a few minutes, will be not less than 2/3 of their regular rate of pay. Employers are expected to restore the employment of the individual at the expiration of the leave. However, employers with 25 or less are not required to restore employment if the position held by the employee has been eliminated due to economic conditions or other changes in the operating conditions of the employer that affect employment and are caused by the public health emergency during that period of leave. The employer is required to make reasonable efforts to restore the employee to a position equivalent to the position that employee held when the leave commenced, with equal pay, equal benefits. And the employer must make these reasonable efforts up to 1 year from the end of the public health emergency, or a date that is 12 weeks after the beginning of the employee's leave. Definitions are critical to interpreting any law, and this one is no different. So let's start with eligible employee. An eligible employee is an employee who's been employed for at least 30 calendar days by the employer with respect to whom leave is requested. The employer threshold and we're only looking at the public health emergency section now. That applies to employers with fewer than 500 employees for each work day during each of 20 or more calendar work weeks in the current or preceding calendar year. There's great discussion on how to calculate this time, and we're waiting for some additional guidance from Department of Labor on just how that works. Their initial guidance tells us that you should include employees on leave, temporary employees who are jointly employed by you and another employer, regardless of whether the jointly employed employees are maintained on only yours or another employer's payroll, and day laborers supplied by a temporary agency. Independent contractors, and be sure that they really are independent contractors as defined by the Internal Revenue Service, are not part of the count. Where a corporation, including its separate establishments or divisions, is considered to be a single employer, its employers must each be counted toward the 500 employee threshold. Where a corporation has an ownership interest in another corporation, the two corporations are separate employers unless they are joint employers as defined under Fair Labor Standards Act with respect to certain employees. If they're found to be joint employers, all common employees must be counted together. Child care provider, this is where we've got great consternation and confusion. The Act simply defines this as a provider who receives regular compensation for providing child care services on a regular basis, including an eligible care provider, as defined under the Child Care and Development Block Grant Act of 1990. This act defines an eligible care provider as a center-based child care provider, a group home child care provider, a family child care provider, or other provider of child care services for compensation that is licensed, regulated, or registered under state law and satisfies the state and local requirements. Or, and here's where we run into some confusion, a child care provider that is 18 years of age or older who provides child care services only to eligible children who are by affinity or court decree the grandchild, great-grandchild, sibling, if such provider lives in a separate residence for the sibling, niece or nephew of such provider, if such provider complies with any applicable requirements that govern child care provided by the relative involved. Well, that's about as clear as mud, and so we need some significant clarification on that as to what is a child care provider. The Act does not give us clear guidance on that. The fact that the Act does require compensation may be helpful, but still very confusing. School is simply defined as elementary or secondary school. Let's move on to emergency unemployment insurance. There is a $500 million assessment for states that meet the requirements under this Act. They include waiving the waiting period and the requirement to search for work. It will also accept the pandemic issue as a reason for unemployment. As of today, the state of South Carolina has not waived the week waiting period and has said that anyone applying for unemployment may be eligible for benefits. These benefits will not be charged against the employer's unemployment benefit accounts. North Carolina has waived all requirements for waiting and looking and is allowing online applications. Also, don't forget about the WARN Act if you are subject to this. Generally, employers with 100 or more employees are required to provide a 60-day advance notice of a temporary shutdown if it will affect 50 or more employees at a single site and result in at least 50% reduction in hours of work of individual employees during a month of shutdown. This has been relaxed, not forgiven, but relaxed for a shutdown that's the result of a natural disaster or unforeseeable business circumstances. And so the 60-day notice is not required for such a shutdown, but you do have to provide as much notice as is practicable. And it is noted that COVID-19 will qualify. And now we're moving on to emergency paid sick leave. This will apply to employers with 500 or less employees, or any public sector employer with one or more employees. The Department of Labor may exempt upon request an employer with fewer than 50 employees if the paid sick days would jeopardize the business and create a hardship. But of course, the employer is going to have to substantiate that. Be apprised, however, the Department of Labor is not ready for these requests, so don't send them anything yet. They've made it very clear on their website that they do not want these requests sent just yet. Also, healthcare providers and emergency responders may elect to exclude its employees from this paid sick leave. This emergency paid sick leave is available for an individual who is experiencing symptoms of COVID-19 and is seeking a medical diagnosis, or an individual who is under quarantine, perhaps it's self-imposed quarantine at the instruction of a physician, the employer, a local, state, or federal official. This leave is also available for an individual who is caring for another who is subject to an order for quarantine or who has been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19, or an individual who is engaged in the caregiving due to a coronavirus-related school closing or other care facility or care program for a child or other individual unable to provide self-care. Same concerns here on child care since we have no guidance. The compensation paid under emergency paid sick leave varies and is based on the following factors: the employee's normal compensation, the number of hours the employee would normally be scheduled to work, and the reason for the leave. But there are caps to these payments. Full-time employees are entitled to 80 hours of paid sick leave. Part-time employees are entitled to a 2-week equivalent, so you'll have to do some calculations based on their average working hours for a 2-week period. The caps are $511 per day and $5,110 in the aggregate for leave that's due to a mandated quarantine, a self-quarantine that is advised by a healthcare provider, or the employee is experiencing symptoms of COVID-19 and is seeking a diagnosis. So full pay, but there are caps. Then for the reasons that are for caring for others, it's a 2/3 payment up to $200 per day and a $2,000 aggregate. This is additional leave for employees and does not eliminate the leave that you grant your employees under your leave policies. However, we may not require our employees to use existing leave prior to the use of this emergency paid sick leave, so we cannot require exhaustion before they tap into emergency paid sick leave. This leave also does not carry over from one year to the next and ceases after the need for the leave ends. It further does not get paid out to terminated employees. It's an entitlement to use, but not to be paid out if you leave the company. Calendar days may not be treated as an emergency leave day if the employee has received any form of compensation, whether it's from us as wages, accumulated leave, or unemployment. There is no double dipping. Don't forget about other laws that come into play, particularly Fair Labor Standards Act. We still have to worry about compliance here. And so if we have someone on a mandatory quarantine, your non-exempt employees get paid for work performed. Exempt employees get paid their weekly salary unless there's no work performed in that particular week. Remote work, be very cautious with this. Make sure your employees who are teleworking or whatever they may be doing, not coming to work but still working, make sure they maintain sufficient time records so you can track their time. Otherwise, you will run afoul of Fair Labor Standards Act. I can't stress enough how fluid this situation is right now. In the last week, I've had to change this PowerPoint 3 times. Things are changing rapidly, and I probably will have to change it again tomorrow. So keep in mind, this is a moving target. And since we're dealing with a lot of federal agencies, a lot of federal laws that are all sort of coming together, I always recommend it's wise to seek guidance rather than seek forgiveness when you're dealing with federal agencies. We are happy to help with questions, concerns. Our phone number is 803-581-8190, Winters Law Firm, and thank you for listening.